Hey mamas, welcome back to another video of a childbirth educator answering your questions. As an expecting mama, I know there are so many questions that you are asking yourself, your friends, family members, and Google, and I know you want to find the answers to those questions to help you feel informed and empowered. So you asked me about eating dates to help with labor, the pros and cons for episiotomies, and what an assisted delivery is. So I'm answering those questions for you right now in this video. I'm Bridget and I'm a childbirth educator and birth doula, and I love helping mamas discover that they are built to birth and find power in that reality so that they can love their birth. If you're new to this channel, I encourage you to join this community of moms and dads who are equipping and empowering themselves with information for pregnancy, birth, and postpartum. Make sure you subscribe and click the little bell so each time a new video comes out, you are the first to know. Asking questions is so important when you are preparing for birth and beyond, because the more you know, the less you fear and the more confident you can be in your ability to parent your baby. This confidence can begin growing in pregnancy and birth and can set you up for your initial parenting experience. By the end of this video, your confidence is going to grow as you get answers to these 3 commonly asked questions. The first question is, can dates really help with labor? And the answer is yes. It's amazing how what we put into our body greatly impacts how our bodies function. Dates are loaded with vitamins, minerals, and fatty acids, and actually can impact the body at a hormonal level. Eating dates have an effect on the levels of estrogen and progesterone in a woman's body. And before we go on about dates, I'm going to explain the significance of those 2 hormones, estrogen and progesterone, when it comes to how mama's body prepares for labor. So throughout pregnancy, progesterone and estrogen levels have been pretty high, and progesterone helps keep the uterine muscle nice and relaxed to keep it from contracting. However, as mama inches toward the end of her pregnancy, the progesterone levels start to drop while the estrogen levels keep rising. And this helps prepare baby's lungs for the outside world where they're going to need to breathe on their own, and it also makes the uterus more sensitive to other hormones in the body such as oxytocin, which can begin those surges. So going back to our question, can dates help with labor? Yes, they do, because they actually help increase estrogen levels in the body and prepare the cervix for labor. Research shows that women who eat about 2.5 ounces of dates per day, about 6 smaller deglet nor dates or 3 bigger medjool dates 2 to 4 weeks before birth, so around 36 to 37 weeks, are 74% more dilated than non-date eaters, 38% more likely to have their amniotic sac still intact, so no broken water before labor begins, and 21% are more likely to go into spontaneous labor and not need an induction. And on top of that, 28% less likely to need Pitocin or another form of medication to augment or speed up labor. In another study, women who ate dates in the weeks before pregnancy were admitted with higher Bishop scores. And a Bishop score is given when a care provider does a vaginal exam, which I talk about in this video that I'm linking up here, which you should watch after this video, and gives a score between 0 and 13 to rate the openness, the thinness, the position, and the consistency of the cervix, as well as where baby is in the pelvis, known as station. And it helps them determine how ready the cervix is if an induction is being considered. So for women who ate dates, they had more favorable cervixes, were less likely to need inductions, but for those who were induced, were more likely to have successful inductions that ended in a vaginal birth. So yes, dates can definitely help with preparing your body for labor and actually help in the labor process, but you have to be eating enough of them to do the job. Like I said, that's about 6 to 7 small dates a day or 3 to 4 bigger dates, like the medjool dates per day. The only thing you want to be careful of with dates is the sugar in them. So if you have gestational diabetes that you're trying to manage, it might be better for you to skip the dates. But if you have a totally normal and healthy pregnancy, there should be nothing holding you back from eating dates to prepare your body for labor. I'll link in the description below some dates that you can buy, as well as the research that I've mentioned so far for you to check out yourself. The second common question I get asked is, what are the pros and cons of episiotomies? And before I answer that exact question, let me explain what an episiotomy is. An episiotomy is an incision done from the vaginal opening through a portion portion of the perineum, which is the area of skin between the vagina and the anus, to help create a bigger vaginal opening for baby to be born through. Episiotomies were common procedures in the past. In fact, in the late 1970s, over 60% of women were given episiotomies as standard care. But since then, the procedure has greatly declined, and the reason for that is because research has shown us that episiotomies are not as beneficial as many care providers once thought they were. In the past, it was thought that doing a small incision would help prevent more severe tears from happening, but what we now know is that episiotomies can actually increase the severity of a natural tear. Most women tear in labor, and is often a fear that women have, especially first-time mamas. I talk all about tearing in this video that I've linked up here and why it shouldn't be something that you're scared about. One of the points I make in that video is that the majority of tears are very minor and heal very quickly. Episiotomies often take longer to heal because it is a surgical incision, whereas natural tears tend to heal quicker and better because it was your body naturally doing it. In general, it's better to allow birth to happen as naturally as possible, avoiding any interventions, episiotomies included, unless they are medically necessary. Now, episiotomies can help quicken the pushing stage of labor, which is possibly another reason why they may have commonly used them in the past. However, if your baby is healthy and mama is healthy, there is no need to speed up labor, especially the pushing stage. If for some reason baby shows signs of distress during the pushing process and the safest thing for them is to be born quickly, it might be in their best interest for an episiotomy to be performed. Or if baby's shoulders appear to be stuck and movement and position changes aren't helping them be born, this might be another reason for an episiotomy to be given to help baby be born vaginally. To avoid an episiotomy, there are several things that you can do during the pushing stage. The first is to know how to properly push in a gentle but effective way, which I talk about in this video that I've linked up here. This video is going to help send oxygen to baby and your hard-working uterus to keep both baby and mama safe during the pushing stage, to prevent baby from going into distress, resulting in quick action being taken, like an episiotomy, to be done. Not only will proper breathing help you birth your baby more effectively and calmly without an episiotomy, but it can help you prevent a severe perineal tear as well. The second thing you can do is to change positions during pushing and avoid laying on your back to push. Laying on your back during pushing increases the risk for more severe tearing and actually makes the outlet of the pelvis, which your baby needs to pass through, smaller. While it's the most common pushing position for women in developed countries, it's also the least effective. Now, if you are curious on which positions to take, not just during the pushing stage, but also from the beginning to the end of labor, I encourage you to check out my Built to Birth online course that covers positions and so much more about preparing for birth that I know you will love if you are looking for a happier, healthier, and easier birth. The third thing that you can do to prevent an episiotomy is to make sure that you clearly state that in your birth preferences, and then have someone such as a doula or a birth partner to advocate for that if the time comes. A lot of times care providers will say, I'm going to do it in an episiotomy right now, okay? And it doesn't feel like you really have a say in the matter. While it is rare that an episiotomy is even done nowadays, I have experienced a care provider who said that exact same thing, just as I said. So as this mama's doula, I had to step in and ask the mama in labor if that was something that she consented to. She did, and then her doctor performed the incision and her beautiful baby was born. But it's important that you have people on your birth team who will advocate for your preferences and goals, so that at the end of the birth experience, you were the one who was writing your birth story. So bottom line, you typically want to avoid an episiotomy, and thankfully, most care providers already do, unless the situation calls for it, in which case it can help keep babies safe and healthy as they are being born. Now, before I answer the last question, don't forget to drop more of your questions down in the comment section below so that I can answer your questions right here in our Built to Birth online community. Now, our last question is, what is an assisted vaginal delivery? An assisted delivery, sometimes called an operative delivery, is one where forceps or a vacuum is used to help baby be born through the vagina. Forceps are like two large spoons that are in a scissor-shaped tool, or kind of like salad tongs, and the spoons are inserted into the vagina and sort of cup around baby's head to help guide baby's head out while mama continues to push. Forceps are not commonly used anymore. Only about 1.1% of births use forceps, but if baby appears to have a hard time coming down and out through the birth canal and pushing has become prolonged or baby is showing signs of distress, an OB might use this tool to help baby be born and help mama achieve a vaginal birth while avoiding a C-section. Forceps tend to be gentler on baby than vacuums, but still carry the risk of giving baby cuts on the face, trauma to the skull, internal bleeding, or sometimes death. For mama, she is more likely to have severe tearing on the perineum and the vagina, sphincter injury that can make passing waste, aka pooping, challenging, or long-term pelvic organ prolapse, where the organs that are supported by the pelvic floor, which is a sling of muscles from the front of the pelvis to the back, slip down into a position that they are not supposed to be in. However, using forceps can be helpful in the right circumstances to allow baby to rotate in the pelvis, which is a crucial part of the birth of baby. Now, vacuum-assisted delivery is more commonly used over the use of forceps, and with the vacuum, a little cup is placed on baby's head and then suctioned and pulled out through the birth canal. This method is typically safer for mama, while forceps are typically safer for babies. With a vacuum delivery, it's not uncommon for baby's head to become unsuctioned and the vacuum has to be replaced back on baby's head. If the vacuum doesn't work for 3 tries, then most care providers will not continue using it. While more and more care providers are using vacuums over forceps, they actually are not as effective in achieving a vaginal birth as forceps are. Plus, vacuums introduced increased risk over forceps of trauma to the skull, internal bleeding, as well as death. Vacuum-assisted deliveries like forceps have a time and place, and while they are not commonly used, can help mama achieve a vaginal birth and keep baby safe and healthy when performed appropriately. More often than not, instead of using these tools, a C-section will be recommended, which still carries risk for both mama and baby, since this is major abdominal surgery being performed on mama. Bottom line, an unassisted vaginal birth is typically the most desirable way for a baby to be born for both mama and baby. However, these interventions can be life-saving when used at the right time and for the right reasons. So to avoid an assisted delivery, make sure that you are changing positions often. As I mentioned earlier in this video, learn to push effectively using your breath so your baby receives plenty of oxygen during the most intense part of labor, and have someone to ask questions and advocates for you. Having a doula decreases the likelihood of needing forceps or a vacuum because 1, they're advocating for your preferences not to use one, and 2, they're helping you find positions that help get baby into an optimal position for birth, and 3, they help you ask questions that allow you to make the best decision for your birth experience. If a doula is not an option for you, having a knowledgeable birth partner can help tremendously as well. Again, in my Built to Birth online course, I give mamas and partners so many tools that they can use in this labor process to help achieve their happier, healthier, and easier birth, and most often vaginal birth as well. If you're feeling like you need more information or practical tools and techniques, check out my course, which I've linked down below in my website, builttobirth.com, so that you can begin building up your mind, body, and team for your empowering and healthy birth experience. So there you have it, mama. You asked and I answered your 3 questions about eating dates to prepare you for labor, the pros and cons of episiotomies, and what assisted deliveries are. I hope these answers are helping you feel more informed about your options when it comes to birth, as well as what you can do to prevent unwanted interventions. Mama, I want to remind you that you are built to birth and you are capable of an empowering, healthy, safe, and beautiful birth experience, however that looks to you. Remember, drop your questions below. Thanks for being with me in this video, and I will see you in the next one. Bye, mamas.